Right, let's move on to anatomy and physiology, which I just find so interesting. It's definitely one of my favourite elements of the theory. So section 3, anatomy, the physiology, we're just going to talk about generally the skin and the skin layers. So skin function, again, hopefully you will have had a read through this manual. I'm just going to kind of break it down for you and just read some of my notes. So the skin's function, generally, what does the skin do? So it aims to protect against microorganisms, dehydration, ultraviolet light, mechanical damage. The skin is the first physical barrier that the human body has against the external environment. So the skin is the largest organ in the body and covers the body's entire external surface. So what are the functions of the skin? Sensation of pain, temperature, touch, and deep pressure starts within the skin. Mobility. The skin allows smooth movement of the body. Endocrine activity. The skin initiates the biochemical processes involved in vitamin D production, which is essential for calcium absorption and normal bone metabolism. And then endocrine activity. This occurs by the release of water, urea, and ammonia. Skin secretes products like sebum, sweat, and I can never say this word, pheromones, and experts important immunologic functions by secreting bioactive substances such as cytokines. And then immunity development against pathogens. Regulation of temperature. Skin participates in thermal regulation by conserving or releasing heat and helps maintain the body's water and homeostatic balance. So that just gives you a bit of an idea of some of the functions of the skin. The skin is the largest organ in the body. It's made up of 3 layers: the epidermis, the dermis, and the hypodermis, all 3 of which vary significantly in their anatomy and function. So we've got the epidermis, which is the outer layer of the skin. We've got the inner layer of the skin, which is the dermis. And then we've got the hypodermis, which is the bottom layer. And it has many important functions, including storing energy, connecting the dermal layer to skin to the muscles and bones, insulating your body and protecting your body from harm. In other words, the hypodermis is the fatty layer. So just to go over these skin layers, and actually it's really important to understand these skin layers when you're working within the skin, when you're working with facials. Although this is a non-invasive facial, we do teach extraction, and sometimes we'll extract, for example, a milia, and we will use a tiny, tiny little needle. So we are actually going into those skin layers. So the epidermis. The epidermis is the most superficial layer of the skin and provides the first barrier of protection from the invasion of substances into the body. The epidermis is subdivided into 5 layers or strata: stratum basal, stratum spinosum, stratum granulosum, stratum ludosum, and the stratum corneum, also known as the horny layer. So you can just see a little image here in your manual that just kind of shows you the layers and how the layers work. So this is basically showing where the skin cells start at the very bottom, work their way up into dead keratinites, and then that's where you get your kind of dead skin cells that shed. So the dermis. The dermis is what sits underneath the epidermis. So it's a fibrous structure composed of collagen, elastin, tissue, and other extracellular components that includes vascular nerve endings, hair follicles, glands. The role of the dermis is to support and protect the skin and deeper layers, assist in thermoregulation, and aid in sensation. So then we've got the muscular system. I mean, I'm not going to go over the muscular system with you too much, but it's definitely something for you to have a look through your manual and just have a rough idea where the muscles are. I mean, when you're doing facials, you don't need to know too much about the muscles. However, it is important to know roughly where they are. For example, we've got our temples here, temporalis, the temples are here. We've got a temporalis muscle. And this is the muscle that runs down the side of the face towards the jaw. It aids chewing, closes the mouth, but a lot of people clench their jaw. They hold their teeth together, they grind their teeth. So when you're doing massage, you can really release tension from this area. Some people that grind their teeth will suffer with tension headaches, so it helps with the tension headaches. So just having a rough idea of the muscles in the face is going to help with your facials. You know, you can massage around the temples. You massage around the orbicularis oculi and it feels lovely. We've got the zygomatic in the cheek and we can really kind of lift that up and really tighten that skin. So there's just a few elements here to the facial muscles. So just a little fact, your face has almost 20 flat skeletal muscles that attach to different places in the skull. I mean, it really is incredible, the human body. There's just some body muscles here, the skull, just having a rough idea of where your bones are. I mean, you're not going to need to know any of this for your assessments for this course, but it's good to have a rough idea. So this is just some anatomy for the body. Circulatory system. So circulatory system is made up of blood vessels that carry blood away from and towards the heart. This is really important when you come to more of the aesthetics element, especially kind of skin boosters, Botox, fillers. Arteries carry blood away from the heart and veins carry blood back to the heart. So a good way to remember that is arteries away. The circulatory system carries oxygen, nutrients, and to cells and removes waste products like carbon dioxide. And then we've got the respiratory system. Again, obviously we're working on the face, but it is important to know this within your anatomy and physiology. The respiratory system includes the nose, the mouth, the throat, the voice box, windpipe, and the lungs. Air enters the respiratory system through the nose or through the mouth. If it goes in the nostrils, also called nares, the air is warmed and humidified. Lymphatic system. This is really important to understand when we're doing facials, especially when we're using ice globes or when we are using gua sha. We can really work with the lymphatic. We can drain the lymphatic system. We can drain the toxins from the face. And there's lots of kind of techniques for lymphatic drainage. Obviously, there'll be a recording in here of us doing lymphatic drainage, but have a look online, watch some videos. It's really, really interesting. So the lymphatic system is a network of delicate tubes throughout the body. It drains fluid called lymph that has leaked from the blood vessels into the tissues and empties it back into the bloodstream via the lymph nodes. The main roles of the lymphatic drainage system include managing fluid levels in the bodies. So that's just a little section of anatomy and physiology, skin layers, and what you need to know about the skin. But definitely do a little bit of research into the dermis, the epidermis, and the hypodermis. Oh my God, I've forgotten the word. I just had to go back and double check then. It is the hypodermis. Well done. Like I say, read your manual, do your research, and before you know it, you'll be able to explain exactly what the skin layers are.